a virtual welcome to the Royal College of Physicians and Surgeons of Glasgow's Medical Heritage Series. If you haven't joined us before, each year the Heritage team at the college pulls together a programme of events focused on all things medical history. And I can't think of anything more relevant than today's event, which is titled Finding the Perfect Disease, A History of Vaccination in Glasgow. So, as I've said, today we will be diving into the unique, fascinating and ever relevant history of vaccination in Glasgow and the west of Scotland, and even slightly beyond that too. And I'm delighted today to be joined by Dr. Deborah Brunton, a senior lecturer in the history of medicine at Open University and former honorary research fellow of the Centre for the History of Medicine at the University of Glasgow. Deborah has spent many years researching the history of smallpox, inoculation and vaccination, and her book on the subject, The Politics of Vaccination, was an influential comparative study of vaccine policy across Britain throughout the 19th century. More recently, Deborah has widened her focus to public health, and in particular the role of local government and parish authorities in bringing order and cleanliness to the urban environment in an effort to control infectious disease. This has taken her work into urban history and medicine in modernity. Deborah, thank you so much for coming along and joining us today. I don't really want to preempt any of your discussion, so I would like to simply invite you to begin talking to us whenever you're ready.
Well, thank you very much. I'd just like to say thank you to the college for inviting me and thanking the support staff for all their help. So, we're talking today about vaccination, but I want to just backpedal before we start and begin by thinking about smallpox. Apologies to anybody who's just had their tea. This is actually one of the slightly less gruesome images of smallpox that I could find. It's not, there's some that are a lot worse. So anyway, why is smallpox such a problem? Well, basically, it's a horrible disease to get, and most people suffered from smallpox at some point in their lives through the 18th and early 19th century. It's very painful, it produces a high fever, and there's a high mortality associated with it. 10 to 20% is not unusual. You can see that it causes lots and lots of spots, and the skin underneath those spots is badly affected, which leaves permanent scars on the skin. If the spots occur around your eyes, you can be left permanently blind. In fact, the only sort of bright side to getting smallpox is that it confers immunity to any further attack. Most people who had smallpox never had a second case. So that's the only good thing, is getting through it. So given how horrible it is, and given that everybody catches smallpox at some point in their lives, during the 18th century, people developed various ways of trying to mitigate the disease. It sounds a bit peculiar, but people did deliberately bring their children into contact with other children who had smallpox. If there was a child in your neighbourhood who had a mild case of smallpox and seemed to be doing quite well, it made sense to bring your child along and hope that they would get the same strain, so they too would have a mild case and they too would recover. From the 1720s, inoculation was practiced in Britain, and that's another form of deliberate infection with smallpox. In this case, a medical practitioner would take some of the liquid that's found in those big spots that you saw in a smallpox victim and rub or insert the matter onto a small scratch on someone's arm. That would transfer, well, as we would see it now, transfers the virus, so you catch a case of smallpox. But again, what you do is you take the matter from someone who's got a mild case of smallpox in the hopes that the recipient too will have a mild case and will recover and will not be badly scarred. It does sound quite strange, but for reasons that nobody has ever been able to work out, it was safer to have a case of inoculated smallpox than natural smallpox. The mortality from inoculation is much lower than from cases of natural smallpox. As I say, nobody knows why, but it did seem to work. It sounds wonky, but it does work. And then we get the development of vaccination, thanks to Edward Jenner, who is the gentleman you can see on this slide. Jenner was a medical practitioner working in Gloucestershire. he performed inoculation quite regularly, but he'd also heard of a story that milkmaids couldn't catch smallpox. And they claimed this was because when they were milking cows, they would catch a disease from the cows. The cows had sort of lesions on their udders. When they were milked, that lesion would infect the milkmaid. And the milkmaids developed spots on their hands, quite similar to those of smallpox. But they disappeared, and the milkmaids were never very ill. But then they never seemed to catch smallpox. It was sort of a folk tale, and kind of lots of people knew about this. But Jenner was the person who said, well, hang on, so let's actually test it. So what he does is, when a case of cowpox occurs in his neighbourhood, he takes some of the material from the spot on the hand of a milkmaid, and he uses it to inoculate a child, the son of his gardener, a chap called James Phelps. And James Phelps develops a spot where the inoculation happens, and it looks fine, and he's not particularly ill. So after a few weeks, Jenner then tests what he's done by inoculating the child with smallpox. And surprise, surprise, nothing happens. So it seems that the cowpox has conferred immunity to smallpox. They had no idea why this worked, but Jenner was convinced he had stumbled onto something really important. And he spends a lot of the rest of his life promoting vaccination. The great thing about vaccination is it's very safe. Cowpox is a relatively mild disease that milkmaids just have spots on their hands. Vaccination, you might feel a bit off colour, but nothing very, very much. You can't transmit cowpox when you've been vaccinated, when you're undergoing vaccination, and you can't catch smallpox afterwards. When you're inoculated, you catch smallpox, so you can transfer it on to other people, as well as you run the risks that you might die. So vaccination is a much, much safer bet. As I say, Jenner devotes a lot of his life to promoting vaccination, describing the procedure, working to inform people around the world, not just in Britain, not just his fellow practitioners. There is one problem with vaccination, though. When you inoculate somebody, you take material from a case of smallpox, and there's quite a lot of smallpox around. For vaccination, you need a case of cowpox, and cowpox, it turns out, is a relatively rare infection. But Jenner discovered that if you took material from the vaccination site, the spot that occurs at the place where you vaccinated a child, that material can then be used to vaccinate other children. But it gets a bit complicated then, because you can only do it at certain times, usually a week to 10 days after the initial vaccination. So to conduct a chain of vaccinations of multiple children, what you have to do is you have to have a starting point, and then you use that child as a source of vaccine for other children about a week later, and then they in turn can act as donors of vaccine for other children. So logistically, it gets quite complicated. The other problem is that you want the vaccination, well, first of all, you want the vaccination to work. You want the child to acquire immunity. But ideally, a good vaccination will also produce lots of vaccine. And to do that, you have to be very careful with the procedure of actually conducting the vaccination itself. So you have to use fresh material that's active, and you have to insert it into a superficial scratch on the arm. If it's too deep, then the cut can become infected and you don't get a proper vaccination lesion. And there's some query as to whether, in fact, the immunity is good either. So doctors kind of work around this problem. They do organise arm-to-arm vaccination. So these chains of one child is used to vaccinate several other children, who are in turn used to vaccinate several other children. They also discovered that you can dry vaccine, which makes it much more transportable. You can send it through the post. It's not quite as good as the fresh, but it does work. And they developed tools like this, which is in the college's collections, and it does look a bit horrendous. But actually, what it's designed to do is to make sure that when you're vaccinating a child, the doctor just makes very superficial cuts into the skin. So it's not too deep, because that's a bad thing. So to make a perfect vaccination vesicle, get me words right, you use a tool like this to make multiple very small scratches or punctures in the skin, and then you put the matter on that, and you should get a nice, big, perfect, as they say, vesicle, which you can then use to vaccinate other children. So Jenner publishes his findings in 1798, and vaccination spreads very quickly across the country. It's in Scotland within a year, and it's been practiced quite widely within a year. You know, it's not just in the major centres in Edinburgh and Glasgow, it's moving out into the countryside and the smaller towns. There's a snag though. Vaccination is expensive because the doctor, of course, has to find a source of vaccine. So he might have to vaccinate a child and then bring the child along to vaccinate other children. They charge a lot for it. So basically, it's confined to the upper classes. So the rich people can afford vaccination. But of course, most people aren't rich. So what about the rest of the country? Well, fortunately, there are quite a number of charitable sources of vaccination, free sources of vaccination. There's a number of vaccine institutes across the country. There were 3 in Glasgow, 1 in Edinburgh, 1 in Aberdeen. So if you're in a big town, you can go along to these places, get your child vaccinated free of charge, bring them back a week later to make sure that it's worked, and the vaccine is then taken for use in other subsequent vaccinations. You can go along to a local hospital or dispensary. These are charitable institutions set up in all the major towns and even in quite small towns. They would run sort of vaccine clinics maybe once a week, perhaps once every few months. And again, you can just bring your child along and get free vaccination that way. Practitioners will vaccinate children free of charge if they need to get a source of vaccine. So a poor child can act as a donor of vaccine for a wealthy child. And the Church of Scotland actually throws its weight behind a campaign to inform ministers how to carry out vaccination. In rural areas, Church of Scotland ministers were a source of free medical care. And there were very few doctors in the 19th century. It's remarkable how few qualified practitioners there were. And ministers would often provide very basic sort of medical care to their parishioners. They would have sort of a first aid kit of common medicines that they could dispense if someone was ill or if they'd had an injury. So the Church of Scotland sponsors a campaign to train ministers in vaccination, and they do go out and they do vaccinate children in their parishes, apparently quite successfully. Midwives, we know, also carried out vaccination, which is great, but it's a bit patchy if you think about it. So if you're rich, you can afford vaccination. If you're in a big town, you can probably access free vaccination. But if you're in the countryside, it's a bit patchy. You might be able to locate a practitioner. You might be able to locate a minister who can help you out. All this changes in the middle of the 19th century when the government starts to introduce legislation to require people to be vaccinated. Starts in England and Wales. In 1840, there's a Vaccination Act, which basically sets up a system of public free vaccination through the Poor Law. In 1853, there's another piece of legislation which, well, it says it makes vaccination compulsory, but unfortunately, the mechanisms for enforcing it weren't really in place at that point. So it's not really compulsory until the 1860s, when you get other pieces of legislation that tighten up the regulations, and basically vaccination becomes much better enforced. Scotland doesn't have a Vaccination Act until 1863, and it goes straight in with compulsory vaccination. And basically, the Act sets up a system whereby when parents go to register the birth of a child, they go to the local registrar. The registrar issues a blank vaccination certificate and a notice that they have to have the child vaccinated. The parent takes the child along to a practitioner, carries out the vaccination, fills in the vaccination certificate, and then that's sent back to the registrar. So there's a system whereby parents are notified of the need to vaccinate, and then there's a system of making returns so that people can check if parents actually have done it, and they can collect statistics on the number of children that are being vaccinated in Scotland. The Scottish Vaccination Act is very much shaped by the work of the Scottish colleges, the colleges of physicians and of surgeons in Edinburgh, but also the Faculty of Physicians and Surgeons, now College of Physicians and Surgeons in Glasgow. The system in England, as I say, is based around the Poor Law. And it was unpopular with practitioners in a number of ways. First, because it meant that poor law medical practitioners carried out the majority of vaccinations. So basically, as some people said, they have a monopoly of vaccination. It's not quite a monopoly, but they certainly do a lot of vaccinating. And there's always complaints that practitioners are not paid enough for their work. And I put this photograph up because it kind of gives you a sense of what's involved if you're a country practitioner in trying to get everybody vaccinated. This poor chap in the bowler hat is a rural practitioner. It's slightly later, it's about 1900. He's probably travelled quite a distance. He's going to vaccinate this one baby, and then he has to go back home and then come back again a week later to check that the vaccination is taken and then go back home again. And practitioners are always complaining that the fees they get don't even cover their transport costs. So when the Scottish legislation is proposed, the colleges quickly put their shoulder to the wheel. And what they want is reasonable levels of pay, which they sort of get. And secondly, they want to make sure that vaccination work continues to be spread through the whole body of medical practitioners. So there aren't public vaccinators in Scotland the way there are in England, and the practice is carried on by the majority of practitioners. Parish medical officers who provide medical care to the poor also vaccinate the poor, and they carry out about 5%, 10% of all vaccinations. So they have a slight advantage, as it were. They've got a kind of captive population. But basically, all Scottish practitioners, if they wish to, could engage in vaccination. So what was the impact of vaccination? Well, we don't know the numbers of people being vaccinated prior to the Vaccination Act because there isn't a way of collecting the statistics. But after the 1863 Act, basically around about 100,000 children a year are vaccinated throughout the 1860s, and the numbers increase in line with the increasing birth rate. 100,000 children is about 80% of the number of registered births. It's never going to be 100% because some children sadly die before they're vaccinated and some are not well enough to be vaccinated, and some of the births are not registered. There's a bit of the system isn't perfect by any means, but basically the vast majority of children are being vaccinated against smallpox by the late 1860s, and it has quite a striking effect on smallpox mortality. We know that before vaccination in Edinburgh and Glasgow, mortality from smallpox adds up to about 10 to 20% of all deaths. So between 1 in 10 and 1 in 5 deaths are caused by smallpox. It varies a bit whether there's an epidemic year. Once vaccination is introduced, the numbers of smallpox deaths drop radically. It varies between about 1 and 4% in the 1810s. So it's gone from 1/10 of all deaths to 1/50th of all deaths. I mean, it's a remarkable decline. Unfortunately, it goes up a bit after that. But once you get the Vaccination Act, it drops again. And in the 1860s, the number of deaths from smallpox has dropped to be around 2 per 1,000 deaths from all causes. So it's 0.2% of all deaths, which is extraordinary, really. I mean, if you think about going from 20% within almost one lifetime, it's gone to being a very, very minor cause of death. I called this one Happy Ever After because what I've been talking about sounds like, it's all going really well. Smallpox is terrible. We have inoculation, we have vaccination conducted privately or through charities, and then we have vaccination legislation, and smallpox is clearly on the run. But so this slide is just a slight corrective to that picture. The first thing to say is not everybody is clearly 100% behind vaccination. If you look at the numbers of children vaccinated, it does vary. Vaccination in some ways is a victim of its own success, because as the incidence of smallpox drops, you can see parents thinking, well, don't need to get the child vaccinated. There's been no cases of smallpox around here. So they don't. So the numbers decline. And then there's an outbreak and suddenly everybody has to rush to get all their children vaccinated. So there's always this kind of variation in the numbers. And the second thing is there are some people that are really not keen on the whole idea of vaccination. In the 1800s, just after Jenner's published his initial papers on vaccination, there's a lot of kind of, well, there's cartoons, but there's also serious discussion in the medical press as to whether injecting someone with a disease from a cow will turn them into cows. There's a famous cartoon of people sprouting horns and tails. But there was actually serious medical debates about, what are the side effects of vaccination. And that sort of fades away in the 1820s and the 1830s. In the 1860s, when vaccination becomes compulsory, you get a new anti-vaccination movement springing up, which is very much along the lines of, why should the government tell me I have to get my child vaccinated? I'm not comfortable with this. I think vaccination isn't safe. I think vaccination may not work. And just why should they do this? I'm a parent. I have the right to bring up my child as I wish. And if I wish not to have them vaccinated, well, that's my business. That's not the government's business. As a consequence, in 1898 and then in 1907, the government passes legislation that says, all right, if you have a genuine objection to vaccination, you don't need to get your child vaccinated. Parents could go to a magistrate or a justice of the peace and declare their objection to vaccination and get an exemption. And surprise, surprise, when that route opens up, the number of children vaccinated really plummets. But of course, by then, smallpox is really on the run. It has become quite an uncommon disease. So again, the decline in vaccination smallpox doesn't come back to the earlier levels. It's still declining. Eventually, you get the end of compulsory vaccination just after the end of the Second World War, and officially, the World Health Organization, after a major campaign globally, announces the eradication of smallpox in 1978. Although, again, there's a little sting in the tail because smallpox virus is still held in laboratories. And you may remember there was a case of a medical photographer who was inadvertently infected with smallpox in a laboratory, and she sadly was the last person to die of smallpox. So it hasn't quite gone away, but very, very, very nearly. Thank you very much.
Thank you so much, Deborah, for that fascinating and just completely comprehensive overview of vaccination in Scotland. There is so much I'd like to discuss with you, and I'm sure that I'm not alone in that. The first thing I kind of thought of when you were talking about, in particular, smallpox, people going round to other people's houses if they had a mild case of smallpox, made me think about my childhood and chickenpox. So there's some continuities that we'll be able to discuss. I'm sure I'm not alone in thinking about these comments and questions, though. So please do remember that the chat function is currently enabled. And feel free to ask the question now. You don't need to hold on to it, and we'll be able to come back to it at the end of the discussion. So thank you so much again, Deborah. For now, though, as Deborah alluded to, the college has a really unique history and a unique relationship to the history of vaccination in Glasgow. And it's represented by our vaccine collections, which date right the way back to the 18th century with Jenner's discovery. You've seen some of our objects already through Deborah's talk, such as the vaccinator, but now I'm going to give you a bit of an overview into the vaccine collections that we hold at the college and within our library. So our vaccine collection begins with Edward Jenner's An Inquiry into the Causes and Effects of the Variolae Vaccine from 1798, and also has further observations written in 1799 and 1800 respectively. It was, of course, through this text that Jenner first explained his experiments with vaccination and outlined his assertion, quote, that the cowpox protects the human constitution from the infection of smallpox. He also provided practical advice on vaccination, including obtaining the, quote, perfect disease sample, as Deborah alluded to, like finding the right blister to obtain the vaccinated matter, preparing and preserving the matter for use, the depth of vaccine incisions, and other best practices and bad practices to be avoided. As Fiona MacDonald notes, vaccination was adopted, quote, exceptionally early by the members and licentiates of the then titled Faculty of Physicians and Surgeons of Glasgow. But for clarity, I'll refer to as the college from now on. Yeah, faculty, college, same thing, but we'll use college from now on. So because it was kind of accepted by all the kind of practitioners in Glasgow at the time, it tended to also be accepted by the Glaswegian lay public. So quickly following Jenner's discovery in 1796, as Deborah mentioned, in 1799, it was William Nimmo, who was a licentiate and member of the college. So he got his license to practice medicine from the college and then went on to become a member of it, conducted the first vaccination in Scotland within the city. And that was incidentally within the year of the 200th anniversary of the college's existence. Yet a rapid approval of vaccination is also noted in the annotations within Jenner's inquiry, which we hold in our rare book collection. So the book is annotated with all sorts of comments, petitions, and even poems lauding Jenner's discovery and its impact on medicine. Although it's hard to ascertain the author of all annotations, there are some differences in terms of the writing style, but they do seem to be fairly consistent. We do know, though, that one poem is written by a Dr. John Riddle, a member of the college from 1783. And he writes, quote, see Jenner there, the laurel on his brow, leads up the Sabrina's commutation cow. Parasiphae smiles at syphilitic strains, but home sheds brazen tears and Errol complains. Now, I don't know about you, but to me, that doesn't make a lot of sense. But just as every good poet should, apparently, Dr. Riddle explains his fine work within the book, saying that his colleague, Dr. Pearson, provided inspiration for the first line, stating, quote, I would not pluck a sprig of laurel from the wreath which decorates the brow of Dr. Jenner. Sabrina comes from Dr. Jenner's work in Gloucestershire, whilst Home and Errol, Dr. Riddle cites as two surgeons of eminence. And because they're reacting negatively to Jenner in this poem, this could reference the anti-vaccination sentiments which emerged almost immediately after Jenner's discovery. Ironically, Dr. Riddle does not include an explanation for Parasiphae, a Greek myth in which an unexplained disease torments the king of Minos, leading to the creation of the Minotaur. Perhaps he thought that was just too obvious, so he didn't need to explain it to his readers. However, what is clear is that vaccination, just 2 years after Jenner's initial publication, is considered to be an important topic and intensely significant development amongst the physicians and surgeons in Glasgow. Jenner's inquiry is scribbled all over and was consistently and earnestly used by members and licentiates of the college. This rapid and seemingly widespread uptake in favour of vaccination by medical practitioners in Glasgow seems to be quite unique to the rest of mainland Britain. And as Deborah alluded to, these anti-vaccination sentiments emerged almost in tandem with the practice itself in other parts of Britain. Thus, given the distinctively positive response to vaccination, coupled with the endemic nature of smallpox within the city, it is unsurprising that the college were inspired to create their own vaccine station. So the vaccine station run by the college was first set up in our old home in St Enoch's Square. From the college's inception, it had been a requirement of the corporation, as emphasised in its charter, to visit the poor gratis after each meeting. Following the development of vaccination, however, this long-standing benevolent arm of the college's business quickly pivoted to providing vaccines to Glasgow's poorest communities, and they did so from 1801 to 1896. This made the college the only professional body to provide vaccinations in Britain. And I can thank Deborah for that interesting fact from her amazing book. They also created one of the earliest vaccine stations in Scotland. Each Monday between 12 and 1, members of the college would, on rotation, attend to members of the public and vaccinate mostly children free of charge. This was one of the only times that the public would be able to enter the so-called Surgeons' Hall, as shown here and seen at the square, and is one of the only instances of the college interacting with public services. Advertisements were taken out in the local newspapers, encouraging the public to attend the vaccine station. When the faculty moved in 1862, so too did the vaccine station to our current residence in 232 St Vincent Street. Our Alexandra room was our previous college hall, and so that became the new home of our vaccine station. As Deborah noted, obtaining successful arm-to-arm vaccination was sometimes difficult, especially if those vaccinated did not return to the station. So a deposit was agreed in subsequent years to provide an incentive to returning clients and their families. So our vaccine registers provide a unique insight into vaccinations done by the college and its members. And these are available to researchers in our library reading room, but are also digitised up to around the 1830s. However, on the surface, they come across as rather innocuous in that their sole purpose is to provide just a simple list of those vaccinated by the college. So we learn the dates of vaccination, the names of those vaccinated, their place of residence and their age. However, the registers also include remarks by the vaccinators themselves. And it's here that the college's utilisation of vaccination comes to life, as well as a true glimpse into the daily operations of 19th century preventative medicine. So I'm just going to give you a wee bit of an example, and you'll see some of the kind of practical application of what Deborah was talking about in her talk and the ways in which vaccination was applied in Scotland. So one of the first vaccinations conducted by the college was done on John Falconer, a 4-month-old boy. As the vaccinators, Mr. Monteith, who was an architect of the college's vaccination programme, and Mr. MacArthur note, quote, inoculation, and they use inoculation and vaccination interchangeably, which will be a bit confusing, but it's definitely a vaccination. So inoculation performed in both arms by a simple puncture, matter taken on the 10th day and a few hours before it was used. Right arm only succeeded. Thus, we see that John Falconer was vaccinated in both arms, and he returned 10 days later, so that the matter, that is the liquids within the vesicle, could be taken from his arm to inoculate future children. Falconer is a telling example of how vaccinations were performed in the early 1800s. However, it is clear that vaccinators were experimenting with the best ways to vaccinate at this time. So whilst he was punctured in both arms, the poor boy, others were vaccinated in only one arm, whilst others were punctured in one arm and scratched in the other. Court plaister was sometimes also used to protect the wound after vaccination, but this rarely occurs in the vaccination registers. But we can still see the purchase of such sundries in the college's annual budget, which is recorded in the college minutes. So as the registers highlight, when children returned to have the vaccinated matter removed from them for future use, the registers also show what I consider to be a ring around the roses process of vaccination. And what I mean by that is they list where the vaccination matter was obtained. So for instance, in the register we are currently looking at, child number 50, who was Edward MacDonald's son, vaccinated on the 17th of July, 1801, was vaccinated by matter taken from child number 45, John Maclay's daughter, vaccinated on July 6th. And so this process of arm-to-arm inoculation continues in this kind of process. And that sort of encapsulates what Deborah was talking about, and that sometimes the practical difficulties of vaccination are quite clear. Whilst vaccinations are carefully conducted and documented by the vaccinators, failure is also reported throughout the early registers, and the vaccinators are very honest and open about the success of vaccination. Indeed, we see the case of David Connell's son and daughter, whose vaccinations were listed as, quote, not succeeded. Furthermore, we see the case of Jean Maclay, aged 14 months, who after failing to be vaccinated 4 times was eventually inoculated with smallpox. And they make clear the distinction between the cowpox and the smallpox. She was inoculated with smallpox. And this highlights that as vaccination became more popular, it did not eradicate the practice of inoculation at this time and was still considered to be a valuable form of preventative medicine. What I find so fascinating about the early registers is that they emphasise the everyday minutiae of medical discovery and innovation. Vaccination did not end with Jenner's discovery, but rather was a slow and painful process of trial and error, which enabled it to be refined and developed into an efficient public health practice. And indeed, we see this development in our later vaccination registers. This one is from around 1865, and it showcases the widespread adoption of the vaccinator instrument, as shown in Deborah's talk, and also the growing and consistent success of vaccination by this time. So within these registers, vaccinators remark that, quote, the vaccinations just now are very perfect, and comment frequently on the quality of the matter obtained from vaccination from children, calling the vesicles collected, i.e. those blisters again that Deborah was talking about, beautiful, perfect, and my personal favourite, the finest lymph of the season. So congratulations to whatever child had the finest lymph of that year. However, experimentation remains crucial to this work, and vaccinators also comment on the best practices for the use of the vaccinator, and that's the instrument that we're talking about now. And as one practitioner states, quote, the vesicles are very perfect just now. Each insertion taking the insertions are made by cuts in a circle. And you can see that in the first diagrams that he shows, the one with the line and then the one with the circles in the bottom. But I often make many more in this manner. And that's what he kind of shows down below. So it's a lot kind of smaller incisions. They're a lot thinner as opposed to the ones above. Later on in the register, we see that this particular practitioner actually changes his procedure to that latter version, to the one with the little thin lines as opposed to the big circles. And he adopts this latter method of punctuation throughout. His experiment and changes to his process change over the course of about 6 months. So we see that this is still an ever-evolving medium and an ever-evolving method of preventative medicine. By this time, the college's role in vaccination has dwindled, and towards the end of the century, they only vaccinated around 900 children a year, a significant drop-off from its earlier stages. As Deborah's talk showed, by this point, the Vaccination Acts were in place in Scotland, and the college was hesitant to continue exerting their limited resources in public health, preferring, as many corporations do, particularly at this time, to focus internally on the state of medical professionalism. The college's role in vaccination ended formally in 1896, with 6-month-old William T. Barclay of 4 Stirling Street being the final child to be vaccinated. So by looking at the role of the college in vaccination during the 19th century, we thankfully see a lot of change in our practice of vaccination. Nowadays, for instance, there is no active part of the virus in many vaccines, and that is the case with the COVID-19 vaccine. We do not go back 10 days after being vaccinated so the doctor can gleefully pick off our scabs for the next round of vaccinations. Yet there is also continuity too. Innovation and evolving technologies, vaccine hesitancy, anti-vaccination, and the need to look wider at the causes of epidemic disease and respond in multiple ways. And with that, kind of covering those sort of key themes, I think now would be a wonderful time to open up for discussion. So if anybody has a question, please feel free to raise your hand or pop any questions that you might have in the chat. What I'm going to do, just as people are wrapping their head around what we've discussed, Deborah, and writing their questions in, is just kind of think a little bit about everything that we've kind of covered. And I absolutely had a couple of questions for you that I was desperate to ask at the time. So I think the first thing I kind of want to ask, just very simply, is like, how important do you think the discovery of vaccines was in responding to epidemic disease, and in particular, as you kind of mentioned, with smallpox?
There's no doubt that smallpox vaccination is very important in terms of controlling smallpox. I mean, as you say, they developed it, it becomes better. I didn't mention that in the 1870s, there's a move to vaccinating calves, young cows, and taking vaccine from them, which could then be preserved in glycerine. So the vaccine itself becomes better and better over time. It is very important for smallpox, but it's a kind of a weird dead end, because vaccination is developed before there's any idea about viruses or bacteria or the mechanism of transferring infectious disease. So one of the things that's kind of always troubled me about having spent all these years and years working on vaccination is, vaccination is brilliant, and then there's just nothing happens until the very late 19th century, when doctors are beginning to understand, the germ theory and viruses, and then you don't get any more vaccines developed until the very end of the 19th century and the beginning of the 20th. So, I mean, in a way, smallpox vaccination is very important for smallpox, but it doesn't actually become a model for tackling other diseases. So, I'm classic historian. Yes and no is the answer.
No, I've actually never thought about that before, that every other kind of vaccination, for instance, malaria, and we have some kind of reference to that with our Ronald Ross collection. But things like malaria, cholera, TB, it's very much a 20th century phenomenon. So it's interesting that there's no similarity. Do you think that bacteriology, that kind of rise, was it almost like the kind of cart going before the horse? So it was Jenner kind of discovered this relationship, and then it wasn't until bacteriology that change was kind of explained and understood, I guess.
Yeah. I mean, that's the problem. There isn't a parallel with for cowpox protecting against smallpox. And I have to say that I have talked to people who work on pox viruses, and there are loads of them. And some people doubt whether cowpox actually existed. I mean, because there's cowpox, there's camelpox, there's mousepox. I mean, it's not impossible that the vaccines that Jenner was using actually came from another source of pox viruses altogether, and he had no idea, because he's just kind of copying what he saw as the natural process that he saw of milkmaids catching this disease and then being protected. So he's sort of copying a natural process, and then once bacteriologists come along, particularly Louis Pasteur, and starts to understand that bacteria and viruses come along later because they're so much smaller, are responsible for passing disease from person to person, and B, that you can develop a vaccine from weakened or killed strains of those diseases. So it's a weakened form of, for Pasteur's one of his first vaccines is chicken cholera, and it's a weakened strain of that disease that induces, as we now understand, immunity. It tests your immune system, and there's natural immune processes. But none of that was understood with smallpox vaccination. So it is this kind of odd thing that just kind of sits by itself.
Yeah. No, until just now, I've not realised just how distinctive it is. But I mean, it's very. You don't want to say serendipitous, because it's not. There is an element of serendipity to it, for sure.
I think there was a degree of serendipity, and I once bumped into one of the doctors who had been involved in the WHO campaign to eradicate smallpox. So they were going around vaccinating the last sort of pockets of it. And I said to him, why is it that smallpox is the only disease that's ever been eradicated worldwide? And he said to me, smallpox is a stupid disease, which I wasn't expecting. And I kind of said, do tell. And apparently, when you get smallpox, you can't spread the disease until you're feeling really quite unwell, and you've probably got spots. So by that point, you're going, oh, I don't feel very well, and you've gone to bed, and you're keeping out of other people's way. Whereas, as you know, when you've got a cold, you can be spreading the cold virus even before you're starting to feel unwell. So, you know, you talk about serendipity. Well, just the way smallpox has this pattern of presentation has helped to eradicate it.
Yeah, and very much that diseases, their sole purpose is to, and in very similar way to other mammals, is to just reproduce and recreate. But it's almost constraining itself, isn't it, by having an incubation period that's so limited, and by presenting itself. So that's a really, it's interesting, the specific circumstances that made this vaccine possible all happened at the kind of right time. We have great question relating to that from Kirsty, who asks, what impact did the germ theory have on vaccination practice? You've kind of spoke about that a little bit with Louis Pasteur, but could you tell us a little bit more just about that kind of bacteriology and the germ theory aspect of it?
It doesn't have an impact on smallpox because smallpox is caused by a virus, and viruses are very, very small. So doctors can't analyze them until the 20th century, by which time, vaccination is kind of on the way down. So vaccination kind of carries on. Where bacteriology kicks in is developing another model for how you develop different vaccines. It must be said too that I think it is important that smallpox vaccination kind of sets the trend, in the sense of the whole idea that you can prevent disease, that you get your child immunized and then they don't have to go through this huge litany of childhood diseases that people did in the 19th century. So bacteriology doesn't really impact on vaccination. There is an interesting incident in the early 1870s. It had always been suspected that you could transmit syphilis with vaccination. And doctors had always said, no, it's not possible. But then there were a couple of cases where it clearly did happen. And interestingly, the government by the stage is like, no, if doctors are careful, it doesn't happen. And the doctors are the ones who said, no, it does happen. And this is exactly how it happens. And this is exactly how it comes about, which is partly why we switch over to the producing vaccine from calves rather than from human beings. So that's not quite bacteriology, because syphilis isn't a bacteria, it's a parasite. But you get the point. Sorry, I'm rambling.
Oh, it kind of shows that there is still an element of risk in these early stages, and that vaccine hesitancy that you talked about has a relevancy. And that actually brings quite nicely on to a question we have from Ross, who says, before the later developments of the vaccinator instrument, in the early 1800s, would it have been a basic lancet used for vaccination, or would it have been, so it was just the kind of lancet? And
possibly not even a very clean one.
Yes, some of the ones we have in our collection would attest to that, definitely. And in relative terms, or maybe even more in contemporary terms, how safe was the early stages of vaccination, and how effective do they think it was? Obviously, you showed really great statistics and deaths, but the practical application of vaccination, what were the risks at that time?
Hard to quantify because nobody is collecting the numbers. They collect the numbers of children vaccinated. Yes, no, were you vaccinated? But nobody sort of collects the numbers of failed vaccinations. The children who are brought along vaccinated, nothing happens. Could well be in those cases that they'd actually been exposed to smallpox as very small children and they had immunity to it, and that's why the vaccination doesn't work. Practitioners claim, and I can't, we can't be absolutely sure that they're being completely rigorous in collecting the numbers. They claim it's, the vaccination works in most cases, that what you might call side effects, so a case where the vaccination site becomes infected, or there's congenital syphilis, heaven forfend, is passed on. They claim those are extremely rare. Now, the problem is we don't know what that means. Is that 1 in 1,000? Is that 1 in 10,000? Very, very hard to know. Certainly, medical practitioners had a lot of faith in it, and clearly lots of children were brought forward for vaccination. And looking at the smallpox numbers, I mean, clearly, smallpox is declining rapidly, and the timing of the two, it's not a coincidence, that vaccination comes along and smallpox starts to decline. So vaccination is working in most cases, but I can't put a number on that for you, unfortunately.
No, but it still gives a good idea of like that, that it is kind of within the medical community, it does seem to be very quickly like, yep, this makes sense, this is good. And Jenner's inquiry, he talks quite a lot about side effects and flu-like symptoms and the presence of the pox. And in the vaccination registers, there's a few where they say that it was successful, but only because a couple of days later, in that kind of 10-day period, the child contracted smallpox. And they don't necessarily relate that to the vaccine or anything like that, but they do record those kind of instances of side effects and when something's happened. And but it's few and far between. And there are also, I should mention, pages and pages where they just don't remark on anything. They're just like, nope, can't be bothered today. I just need to vaccinate and get out and get my dinner. So the example you showed in the talk is they are not exceptional, but they're the kind of more glamorous parts of it. So kind of related to what we were just saying there, I've got a question from Katrina, who says, do we know how babies cope with smallpox vaccination? Was there a lot of screaming? And I'll add to that a little bit as well, just about the fact that it was children that was vaccinated. I find that really interesting. And if you could perhaps also speak to why that might have been the case.
I suspect there was a lot of screaming. I mean, there's quite a lot of screaming now with immunizations, and the needles are quite small, so compared to what went on in a vaccination, it had to be uncomfortable. I mean, we have a few paintings of children being vaccinated, and of course the children are looking very calm, although generally for artistic purposes, the child is often in a quite peculiar position, kind of like this, because the artist wants to show what's going on. So the kids kind of, it's all very odd. If you're curious, just Google vaccination portraits. Quite a lot of them were done in France. I suspect a vaccine station on a busy day full of mothers and small children, and probably older children who were brought along because they couldn't be left at home, it probably was pandemonium, frankly. Initially, it is only infants who are vaccinated, partly because Jenner is absolutely convinced that one vaccination gives you complete immunity for life. However, by the 1860s, and particularly during a severe outbreak of smallpox in 1871 to 73, it becomes clear that teenagers, children in their late teens and early 20s, come down with smallpox. They have a very mild form of the disease, and there's actually quite some debate about whether they have got smallpox or they've got something else. So from that point onwards, there is a move to have a second vaccination when you're about 14, to, as we would see it now, to improve your immunity. And that becomes fairly kind of standard practice in the late 19th century. So it does move from being predominantly infants to being you get done twice.
Which is there's just so many similarities towards what's kind of going on at the moment, and we'll speak about that in a moment, I'm sure. But it's astounding just how much the history is just essentially a step-by-step process in what we're seeing today. So going back to the fact that it was kind of children, was there a reason adults weren't vaccinated? Or was it just earlier the better? What was the kind of rationale behind that?
Earlier the better. And when Jenner starts, smallpox is still quite common. So basically, if you don't vaccinate children, and he is advocating, vaccinating, a few months old. So it is very small children, it's infants. Because if you don't, they'll catch natural smallpox anyway. So in a way, you've got to do it quickly, because it's so hard to avoid smallpox, because it's, especially if you live in a city, the disease is more or less present at all times. So you can imagine in the very crowded housing conditions of the 19th century, it would just be so easy to come into contact inadvertently with a case of smallpox. There's a great kind of sort of moral panic at one point in London, not in Scotland, that people with smallpox are being taken to the hospital in hansom cabs, in taxis. So what on earth happens to the next person to get into the taxi cab, because they'll catch smallpox? You know, it's a bit of a kind of a storm in a teacup. But again, it shows you, you know, if you wanted to, it's like trying to avoid COVID. You know, you don't know. You don't know who's got it. You don't know who you're going to bump into. You can pick up the disease so readily. So it's do them early, and then that's it. You're done. You're sorted. You're safe.
Yeah, definitely. It's certainly something that is essentially, if you're not vaccinated, you've had it, and that's just kind of it, isn't it? So no, that's really fascinating. To add to Katrina's question as well, and another example we have in terms of small children, it's not until around 1850 or the kind of mid 1800s that the college decides to not, as a rule, obtain matter from children under 4 months old. So they have a discussion at one point as to whether or not it's kind of ethical to bring a child back 10 days and then take matter from their kind of blistered area, and they doing that after 4 months, and they don't ever give any explicit reasons as to why that's the case. But I'm sure that the child's well-being, or the well-being of the vaccinators' eardrums, was perhaps the reason for it.
Yeah.
But yeah, so it's something that you've mentioned in your talk that I'm sure a lot of people will be interested to hear more about. Turning into cows when you've been vaccinated. That was, I mean, so we've danced around the kind of anti-vaccination movement a wee bit, but could you tell me a little bit more just about the general attitudes of doctors who are vaccine hesitant at this time, and just a little bit more about some of the concerns they had? Because as we've said, you know, that there is legitimate concerns, and things such as arm-to-arm inoculation that gets banned in 1896, I believe. Pretty much a century after vaccination is discovered. So could you talk a little bit about that, please?
Yeah, I think the initial, you know, people turning into cows, on one hand you kind of go, what? But on the other hand, nobody had ever suggested that you could possibly take a disease from an animal and infect humans with it deliberately in order to make sure that they didn't catch a separate and quite different disease. So, I mean, I think when Jenner produces his paper, you know, perhaps not surprisingly, some doctors are really skeptical of it. I mean, just the whole principle sounds completely mad. And so there's a lot of pamphlets written, and many of them, it is basically just this whole principle. You cannot, you know, it's against the Bible. You know, God wouldn't like it, is one of the kind of arguments against early vaccination. And there's a very famous cartoon by James Gilray of people sprouting cows coming out of their heads and this kind of thing, which is just a pictorial representation of this debate. But there are sort of serious pamphlets as well. I mean, there's one doctor who claims that he vaccinated a child who then developed strange swellings on his face, which made him look like a cow, who is known as the ox-faced boy. And another doctor, I think, claims that he vaccinated a child who then started to grow hair. So there are sort of serious reports of children who have very strange side effects from early vaccination. It must be said that these kind of just die away very quickly. So it does seem to be kind of, did they make them up? Was this a doctor, you know, a doctor who thought that Jenner was basically competing with Jenner, you know, who wanted to get into a public debate with Jenner to kind of gain publicity for his own position. So there's these early debates. And then, as I say, once compulsory vaccination comes along, then there's the whole debate around the issue of compulsion, because there's a difference between encouraging people to vaccinate their children and, if you don't do it, you can be fined and you can be sent to jail. Again, this is something completely new. This has not happened before. So it's a very sort of strange thing, and perhaps not surprisingly, people get very up in arms about it. They're not sure about the whole thing. You can imagine a parent who's kind of not sure about vaccination, and just as now you can Google things and find arguments on both sides. COVID is safe, COVID vaccination is safe, COVID vaccination is not safe. You could read things in newspapers, you could read things in pamphlets, you could read books, and some of them would say vaccination is fine and it's perfect and nothing to worry about at all. And you could read something which seems to be from an equally legitimate source that says, no, vaccination, it doesn't work. Lots of people have had their children vaccinated and then subsequently get smallpox, or they're vaccinated and then, they get an infection in their arm and their arm is left withered. I mean, if you're a parent, that's a serious kind of consideration. And then it's just the whole thing of, and how dare the government tell me what I can and can't do? This is not an age when the government tells people what they have to do a lot. Compulsory education is 1871. Up to that point, parents didn't have to send their children to school. Government doesn't interfere with children's upbringing very much at all until the very late 19th century. So when they say, no, you're going to have your child vaccinated, perhaps not surprising that people get very sort of principled objections, just in the same way that we see with COVID. People say, well, I've read that it's not safe. I've read that, COVID, it's not that serious. I've read that, and the principal thing of, I just don't want to be vaccinated. I don't care what the government tells me. I just don't want to do it. So that sort of principle, no, the government should not be telling me how to live my life. And it was there in the 1860s. Sorry, as a historian, you just have to say, oh my God, wait long enough and something will come along again. Yeah. And it does.
History doesn't rhyme, but it repeats itself, or it doesn't repeat itself, but it rhymes, whichever one you want to go for. So thank you. And you've kind of raised a pretty much a question that I was thinking about throughout the whole time. And we talk a lot about the role of cholera in terms of the development of public health and improving kind of urban environment, and that kind of leads into your later work. But how do you think that the smallpox vaccination and the public vaccination, is that public health, and is that the start of the development of public health, or does it very much remain preventative? How is it kind of seen at this time?
It's kind of, it's a sort of slightly different thing. It sort of stands off to one side. Compulsory vaccination, well, the vaccination legislation. So the first act is 1840 in England and Wales. That's just about the start of the sort of public health movement, and the realization that cities are filthy and filth is linked to disease, and really we need to clean things up. But the thing is, the people who were cleaning up the towns and cities were mostly local government. Okay, there's legislation telling them what they ought to be doing, or encouraging them to do certain, make sure that there's a water supply and so forth. But it's very much local government that's doing that as part of kind of civic improvement. Now, vaccination is something that's done to people by medical practitioners. So it's kind of sort of almost like a private contract, as it were, between the parent, the child, and the practitioner. So it's happening at the same time, but it's happening in a very different sort of arena. I mean, it's kind of easy again for us to kind of see parallels, but I don't think people did in those days. I mean, you don't read about public health and find people saying, oh, well, we must get rid of cholera in the same way we get rid of smallpox, because there wasn't any way of preventing cholera apart from this kind of widespread cleaning up of things. And that usually happened once an epidemic started, and it's tackling the environment. Vaccination, you get an epidemic of smallpox, you quickly round up all the susceptible children and vaccinate them. So it's one is about people and one is about the environment. So, and one is central government and one is local government, and one involves practitioners. And public health doesn't involve a lot of practitioners at this time. It's men with buckets and shovels and brooms, basically.
Absolutely, it's janitorial work, and it's, you know, as you say, cleaning
Yeah.
up that urban environment, and it's very much a civic duty. And yeah, practitioners, and I think that's possibly one of the reasons that the college pulls back on that vaccination process towards the end of the century, because they see this emerging public health movement, and that the vaccination, they could argue, is this one little remit within their business and within their charter. But then you expand the implications, and I think that's kind of when they start to go, "Up a minute, wait a minute." And you said earlier about
also by that time, every sort of town and city has a medical officer of health. So there are medical experts who are dealing with public health issues, and probably the college kind of felt like, you know, when there aren't other practitioners doing what they do, you know, other practitioners will vaccinate individual children, but they'll charge. So they're offering free vaccination to the poor. So they're doing something that in a way doesn't compete with other practitioners. But once you get medical experts embedded in public health, and by the late 19th century, they are tracking diseases. You know, they are trying to take steps to control epidemics and in all sorts of various ways. So there's another sort of group of people doing what they've been doing. So I think they can feel, okay, we've been doing this for a while. We can step back from this and focus on other things, because, you know, institutions, they do move their areas of activity as time goes along.
Absolutely. And at that time as well, you're thinking, like, you know, you've had the Medical Act, you've got all sorts of kind of medical professionalism things going on. So yeah, that it does make sense to me that it's the 19th century and the end of the 19th century when the college's role kind of ends in vaccination at that point. I've definitely exhausted all my questions. If anybody does have any future questions, though, you can find us on Twitter at RCPSG Heritage, and we will be sure to pass them on to Deborah or help answer them ourselves. Thank you so much again, Deborah, for joining us. If I can just ask everyone to give a virtual round of applause, that would be wonderful. Claire's put in the details of Deborah's book on the politics of vaccination. We have a copy in the library, but yeah, it's wonderful, and it has a great chapter on Scotland in particular, but also the rest of Britain if you're interested. But just again, thank you so much everyone for joining, and thank you, Deborah, for a fascinating discussion.
Thank you very much for having me.
Okay, so see you all later, and thank you so much again.